What is a pancreatectomy for serous cystadenoma? Imagine discovering a small, benign cyst in your pancreas that's causing no pain or symptoms. Sometimes, doctors recommend surgery to remove it, especially if it's large or uncertain. That's where a pancreatectomy comes in. A pancreatectomy is a surgical procedure to remove part or all of the pancreas affected by a serous cystadenoma. These are non-cancerous cystic tumors that usually have very low chances of turning into cancer. Usually, they don't need surgery unless they cause symptoms like pain, blockages, or grow large enough to risk complications. Sometimes, doctors aren't sure if the cyst is completely benign, so removing it helps ensure there's no hidden cancer. The main goal of surgery is to eliminate the cyst while preserving as much healthy pancreatic tissue and function as possible. The type of pancreatectomy performed depends on where the cyst is located and how big it is. If the cyst is in the tail or body of the pancreas, surgeons often do a distal pancreatectomy, removing that part of the pancreas. Sometimes, they can save the spleen, which helps maintain immune health, using techniques like the Kimura method. If the cyst is in the middle part of the pancreas, a central or middle segment pancreatectomy might be done to remove just that section, keeping the head and tail intact. For cysts in the head of the pancreas, which are less common, a more extensive surgery called a pancreaticoduodenectomy or Whipple procedure might be necessary. This involves removing the head of the pancreas along with parts of the stomach, bile duct, and small intestine. In recent years, minimally invasive surgeries using laparoscopic techniques have become more common. These approaches reduce recovery time and help preserve pancreatic and splenic function when possible. During surgery, the surgeon carefully removes the cyst along with a small margin of healthy tissue to make sure no abnormal cells are left behind. They also aim to preserve the main pancreatic duct and blood vessels to keep the remaining pancreas working well. Postoperative risks include pancreatic fistulas, infections, or loss of pancreatic functions like digestion and blood sugar regulation. However, with experienced surgeons and modern techniques, these risks are minimized. Overall, a pancreatectomy for serous cystadenoma is a tailored surgical option designed to remove benign cysts when necessary, while protecting the healthy parts of the pancreas. It's important to remember that surgery is usually reserved for cysts that are causing symptoms, are large, or have uncertain diagnosis. Always consult with a pancreatic specialist to determine the best approach for your specific situation, as each case is unique and requires personalized care.